Hey, what's up guys? We are in Tampa, Florida, Powerhouse Gym downtown. I'm here with the KnotDoctor, Jeff Trager. He's been a therapist for over 12 years, been treating pro athletes in terms of rehabilitation, performance, just even maintenance too, and helping guys get the most out of their intense training. So Jeff's taking care of me in prep for the World Championships, and maybe you can just talk about what you've discovered about my body, what the commands are with me today.
Yeah, absolutely, no problem. And one of the things ART is really good at is bringing your range of motion back. So what we're working on with Vince is getting the internal and external rotation back. The other thing is he's having some tightness in the hips. So we've been doing some ART on that. It's pretty aggressive work, but it's really good at opening up the area in a really quick period of time. So we're gonna go ahead and show you what I'm doing to his shoulders so you can kind of get an idea of how it works for you, okay? Go ahead and just right there for you. Alright, so we're going to start here in an internal rotation movement. Nice and slow internally. Basically right now I've got my thumb tensioning on the rotator cuff. Go ahead and breathe. Use my arm as a lever. And we're bringing that range of motion back. I'm going to help you out. Stay at the bottom for me. A little farther. Good. Come back up. Now we'll go back down. Now right now we're just working on that internal rotation. Good. Grab your hand. Keep breathing. Excellent. Stay down there for a few minutes. And come back up. Now we're working external rotation, trying to be able to get him to bring that arm back. There you go. Keep breathing. Keep your posture good. Perfect. Come back down. All the way down for me. There you go. Come back up. Breathing. As you can see, it's kind of aggressive, but we want to try to get as much of that rotation form as possible. Good deal. Now do me a favor, just go internal, external for me. Yeah, I mean, you're getting behind your ear, which is really good. So that's one of the things that we're doing for the shoulder. Let's go ahead and do the hip, and I'll go ahead and do this in a land your side, Vince, and face that wall for me. On your side, face that wall.
This is a nasty one.
This is one of the more aggressive ones, but when you have some low back pain, it's one of the good release moves that can really take some pain and pressure off of the hip flexor. Now normally I would do this right on his skin, but we don't want to reveal too much of his body on tape. So do me a favor. Get the leg going straight down. Right there, nice and slow. Don't move too fast. Go ahead and reach up. Reach up. Reach up. Good. Hold. Now what's really important about the hip flexor is that it dives into your spine and it attaches on the inside of your spine. So when that particular muscle is really tight, it'll cause all kinds of pelvic problems. Go ahead again. Don't move your arm yet. There you go. Extend back and now reach. Excellent. And that's basically what we're doing right now for him for these two particular areas, and then we're just doing some deep tissue massage to release and flush out the rest of his structure, get him going full on for his training sessions. And then we'll go ahead and we'll repeat the other side as well.
Okay, great. Here you go. That was a really simplified version. Very, very, very condensed. And I just want to kind of give you guys a feel for that. You know, with Jeff, he's doing a combination of things on me: stretching, ART, and even some deep tissue massage. And sometimes I'm so sore that it can just flush me out. You can't even really get in there.
That's true. And really, you need to find a therapist who really knows how to go back and forth between the different type of techniques they do to really get the most out of your session.
Maybe you can just kick back some like simple knowledge that viewers at home can use. You're giving me a lot of tips in terms of like rollers, medicine balls, things that I can do that don't involve, you know, actually
another person.
Yeah.
Okay, so there are two things in particular for your hip flexors and for your legs in general. One is finding a med ball. It should be about that big around, okay? And it should be one of the hard med balls that isn't gonna compress when you lay on it. Now, you're gonna do both sides. You're gonna work the hip flexor side, and you're also going to hit the glute side. Now when you roll on the med ball on the glute, you're literally going to sit down on the ball like the letter L. And you're just going to put one butt cheek right on the ball, and you're going to roll around, you're going to look for that area where it feels hard, where the ball does not want to roll. You want to try to get in there and get the ball to break up some of that tissue. So that's one thing we said. The other thing is for the hip flexor. Now, hopefully you can get this. If this is the ground right here, when you lay down on the ball, your forearms are going to be on the ground like this, and one of your legs is going to be hiked up to the side this way, okay? The hiked up leg is going to be the leg that's going to push you around. When you put the ball down, you're going to find your hip bone right here, and then just move medial to the hip bone, and you should feel the hip flexor. You need to relax your abdomen so you actually are falling down on the ball. If you're doing it right, it should be really uncomfortable. As a matter of fact, you may feel it refer down towards the pubic area or even up into your abdomen. That kind of lets you know you're getting on the spot. Get in there, make that part of your overall routine.
Yeah.
Next thing is foam rolling, okay? The side of your legs, your IT band, all your quads, and even your hamstrings. And literally, when you're doing the quads, again, you're gonna lay on the ground like this, you're gonna put the foam roller right across your quads, and you're gonna roll up and down. Do the same thing as you did with the med ball. You're really trying to feel what's going on with the foam roller. So go ahead and find all the little areas that are really sore and try to roll those out. Stretching is one of the biggest things people really are not doing. So if you're working out, stretch like it's your job. There are so many stretches you need to do, it's kind of hard to go through right now. What I would tell you is find a good stretching book, all right? And then follow some of those and just get in the habit of doing your stretching, because it'll pay dividends in your workout.
Try and make his life easier when we come in here.
A little bit, just a little bit.
So that's great, Jeff. So Jeffrey's got a lot of knowledge working with professional athletes. He's here downtown Tampa, Florida. And where can they find out more about you?
If you want to find out more about me, you can go to my website, KnotDoctor.com. That's all spelled out.
KNOT.
KNOT. Exactly. Doctor all spelled out. Shoot me some emails. I'm on Facebook as well. You can certainly find me through there. Shoot me some questions you have. It may take me a couple days to get to you because I'm super busy, but I'm more than happy to answer your questions.
Well, thanks for the time. Thanks for taking care of me. And
no problem.
See you guys next time.
Be good.